A new mental health crisis center in Kansas City is already busy, filling a gap that for so long had police trying to find answers to complicated problems.
And 41 Action News reporter Sarah Plake brought you this story first before the center opened and shows us how it's making an impact now. She joins us from 12th and Prospect. Good morning, Sarah.
Good morning. This assessment and triage center is meant to take the burden off of emergency rooms and jails. Mental health advocates and police agree those are no places for somebody who's suffering from a mental break or complications from a substance abuse disorder, or both. Now, this has already helped so many people. It has officials wondering why we didn't have this sooner.
1108.
Russell Newland is filling out housing applications. It's better than his makeshift shelter at 9th and Harrison. This is his third time at the Kansas City Assessment and Triage Center, trying to figure out a more stable future.
I have an appointment with tomorrow at 12.
Before the KSHB opened, people like Russell struggling with mental illness and or homelessness would end up in the ER or jail if there was a crisis. Program manager Stephanie Boyer says they do what the ER and jail don't, connecting people to the services they need.
People are often told where to go and what to do, but sometimes they just really need someone to hold their hand and kind of do that along with them. 250
people have come through the KSHB in the 2 months since opening. It has a sobering and stabilization unit where clients can stay for up to 23 hours. Then case managers will help them get housing or medication.
It's beneficial to have this open now because we have a place where we can take people that have slipped through the cracks before, that haven't met the benchmarks for long-term hospitalization.
KCPD officer Eric Anderson said they'd get calls on the same people several times a day.
The person gets released out into the community again and hasn't really been helped at all.
Kansas City emergency rooms get 17,000 visits a year from people with substance abuse disorders and mental illnesses.
Psychologists, psychiatrists in the jail, they're overworked just like everybody else.
Boyer anticipates the KSHB getting busier as word spreads that there's a different option. The new challenge moving forward will be how to handle more people in that 23-hour limit who often have to sober up first.
We lose some hours there sometimes, but we just have to, as soon as we can, have those conversations and figure out what's going on with people.
That's where I need to be.
Russell never intended to come to the KSHB, but it's given him a door where he didn't have one.
They've been a blessing.
Rediscover operates the KSHB with funding from the city, Ascension Health, and local hospitals. They hope to open more crisis center like this one in different parts of the metro. In Kansas City, Missouri, I'm Sarah Plake, 41 Action News.